Welcome to the Rehab Remix,
where we break down the hottest topics in ortho and neuro PT to help you elevate your clinical game. We're your hosts, Dr. Lauren Tide
and Dr. Lauren Young, bringing you practical insights straight from the evidence to your earbuds.
Welcome to Off the Mat, an inside look at specialty practice. This is a special series from the Rehab Remix podcast. Here we step beyond the clinic floor to explore the unique paths PTs are forging in specialized settings, from pediatrics to performance, from neuro to niche practices you didn't even know existed. Each episode takes you inside their world, uncovering how they blend expertise, creativity, and passion to redefine what it means to be a physical therapist. Get ready for real stories, fresh insights, and a deeper look at the profession, because PT goes far beyond the mat.
You know what time it is? The mic is on, the vibes are right, and we're diving back in. This is where research meets real life and voices from the field bring it all into focus. Put your headphones on. It's time to remix.
Hi, everybody. We are so excited to have our guest here today. We have Dr. Beth Maas, who will be talking about her experience in working with professional dancers, elite dancers, specifically with some Dancing with the Stars experience. So put your headphones in. We are so excited to have you with us today, Mary Beth. So if you want to introduce yourself, that'd be great.
Sure. I'm Dr. Beth Maas. I have been a PT for almost 10 years now and have really niched down into treating dancers. So my day-to-day is treating more of the competitive adolescent dancers, but then I do have some backstage contracts where I've worked with Dancing with the Stars. And before that, when they were still touring, I did a few So You Think You Can Dance shows. So I became an entrepreneur and a mom and a wife all within like 15 months during COVID. So I have two kids. My oldest is almost 4, my youngest is 3 months. So it's really fun to be able to find the balance of, really being able to nourish my kids and kind of create a business and a treatment model that is very niche down. And really helps dancers feel more confident in their bodies. Their body is their career, to feel more confident performing and feel less pain performing, of course.
Yeah. And so because I have known you outside of this, you did a residency, correct?
I did. So I actually, I went to LSU in Shreveport, and after I graduated from there, I worked in all settings in my hometown for a year. So I worked in inpatient acute, inpatient rehab, and an outpatient clinic where I saw a little bit of everything. I did see some young, more sports-related injuries, but it was a lot of just your general orthopedic injuries. Lots of total knees, total hips, a little bit of neuro sprinkled in there. And I'm really glad I did that first year out. I think there's some benefits to jumping right into a residency because it is like going back to school and it is a huge pay cut. So it's a transition, but in working in all settings and really, spreading my feet out, I was really able to get very intentional with my next move and not just jump into the next thing because I thought I needed to jump into the next thing. So I knew I loved ortho, but I also knew that long-term, the low back pain, total knees, total hips, there's an absolute awesome place for PTs who love that, but that wasn't what I was most passionate about. And so I really wanted to work with young athletes from an orthopedic standpoint. I knew what I wanted my mothering to look like, and on-field events didn't really support that. And so I worked really hard to find a residency that was going to support exactly what I kind of envisioned for my life plan before I even met my husband. And I found a few residencies, there may be more now, but it was an orthopedic residency in a youth sports department. So it was at Cincinnati Children's. There was a few. I decided at CSM 2017 that I was going to pull the trigger and apply for a residency. And I had missed all the deadlines, but like 2. So I applied to the 2 that I didn't miss. And I got accepted into Cincinnati Children's, and I accepted it before I even knew where Cincinnati was on a map. I'm from South Louisiana. People don't really leave. And so I accepted it and went go visit the program and loved it. They actually had a dance clinic. I had a background growing up dancing, having lots of injuries, lots of chronic health issues. So I came into PT with a very holistic perspective, kind of before the holistic thing was trendy. I just knew from my experience in healthcare and with my injuries that oftentimes you need to zoom out and look at the whole person. And so I found this residency, which had a dance clinic that had an MD, a nutritionist, an exercise physiologist, PT. It was a very comprehensive dance clinic where you could very easily refer an injured dancer to the professional that they needed most at that time. And I just fell in love with the niche. I had really great mentors. Ali Philippa is one that comes to mind. She was one of my mentors in the residency. She was in the dance niche before it was really big. It's not really big still, but it was really small when she started. And Teresa Smith, which actually worked in a different state, but she did some research with us, and I had really great mentors that really cultivated my love for treating the young dancers.
So something that you said, I get a handful of like Instagram messages that's like, should I do residency? And I'm like, I don't know. Like I applied for a residency, didn't get it, knew that there was only one residency I wanted to do. I didn't do the research that I should have done previously, but I knew if I didn't get their residency, I wanted to stay and work. Looking back, they took, through the neuro ICUs, pediatric ICUs. Like I really don't have interest in being in those settings. So that's what I tell people. Like what the research that you did to find something that what is your goal? Is your goal to be a better outpatient therapist? Then sure, you can look for residencies that have a majority outpatient experience. I'm speaking in the neuro world now, but because there's so many different ones. But from my lens, are you wanting to do something more acute? Then look for a residency that supports that. But I think exactly what you said. So many students come out of school and it's school residency. And that's kind of always been the model because also, as you mentioned, it's a pretty big pay cut to go from making a full salary to making a part-time salary because really in residency, it doesn't feel like you're working part-time, but
No,
you are only treating patients part-time. So they're
right.
only paying you for part-time. And again, if salary is important, there were 2 programs in Houston. One program you saw patient care 75% of the time. The one that I applied for, you saw 50% of the time. So there were salary differences. But I think like being able to recognize what your goals are. And it sounds like you had this goal of treating dancers. Like I feel like Dr. Tig and I are out here in the wind. We're like, I want to treat neuro. She wants to do like youth athletes and like we don't have that specific goal. But when you find that goal and focus on that goal, the path there is so much more clear because you know what your end result is going to be. So that is a very unique perspective. I just kind of want to hear now how you took kind of your experience. I heard you say you had some chronic health issues. How did you take that? Did you have physical therapy at that point in time? And then how did that shape your business that you've created today?
Yeah, so it has everything to do with how I have created my business today. I'm very spirit led without sounding too cliche. Like the Holy Spirit gives me a vibe and I go for it and I don't question it. And it has like really led me to where I am, including all of the health stuff that I went through. I got really sick. Gosh, I don't even know how old I was. Probably 6th grade, something about that, and was hospitalized. And after then, I don't know if it did something to my gut or if it just created like a chronic sympathetic response in my body, but my health was tough to manage through the traditional medical system for years. And so, I saw a lot of doctors, there's nothing seriously wrong with you. We can't pinpoint a diagnosis. It's probably autoimmune in nature, but we can't really give you an answer. And so, bless my mom, she never really accepted the concept that like, well, this is just how she's going to have to live. Like she's just going to have to be a chronically sick kid. Without much of the internet, we probably still had dial up at the time. She, reached out to anyone she could. She fostered curiosity with me. We didn't get to like a ton of answers, but she definitely gave me the spirit of like stay curious, don't own anything that they tell you, but do whatever is going to help to manage your symptoms. Let the healthcare system help you manage those symptoms, but never give up on like figuring out what's going on and looking at it from a big picture. And so with that came a lot of injuries, and it was more like chronic injuries, which looking back was more of just a general health system, my aches and pains. It wasn't necessarily like acute injuries that wouldn't heal. So I would go to PT. It would help a ton while I was in PT and out of dance, but there was no bridge. It was like PT, dance, PT, dance, PT, dance. And it was always that back and forth. And it got to the point where there was a little bit of scary language given by some orthopedics of what a future continuing to dance could look like. So it obviously fizzled my passion for it. Again, looking back, now that I'm in the niche, it wasn't scary. It was totally manageable, but it gave me a lot of perspective, and it helps me really empathize with the dancers that are going through that, because they're dancing, especially nowadays, at a super high load. And not everyone understands the demands of dance and how injuries can fall into place with that. So it's really given me perspective on to ask about stress levels, to ask about nutrition, to ask about hydration, and not necessarily to overwhelm them with things they need to fix, but to start from a younger age, giving them the idea that all of your health is connected and you need to find ways to be consistent in taking care of your body, especially if you have a long-term goal of having a career in dance. You're going to be putting high loads on your body for a long time, and you're going to have to take care of it more than someone who's just walking a few blocks every day. So it's given me a ton of perspective on staying curious with the person. Everyone presents differently, and getting a broader picture of what environment this injury is happening in.
Uh-oh. I really love that perspective because I feel like we really kind of forget that educational piece, like that nutrition piece, the whole body, which I think is huge. Especially, it's so interesting to me because you're talking about treating elite performers in dance, but then you're also talking about like youth performers in dance, which like that is what I love. And I think when people ask me, where's your passion? It's honestly youth athletes. You want to know why? It's turn into collegiate athletes. They turn into professional athletes. They turn into all these things after. And if you don't set that framework from the beginning, that's where really things start to fall apart. So, and it's funny because I was going to ask you about like things like that maybe people don't really understand about dancers, but you already hit that, which I think is great. But my other question that I wanted to ask is how, and I think a lot of our listeners are probably wondering, how did you get involved with Dancing with the Stars? Well, you're still working with this youth population. How did you get involved with Dancing with the Stars? How do you manage both of that? And then also like you're a mom, you have a life outside of that. So like talk to us a little bit about that, because I think for those listening, they're probably wondering like, how is she doing all this? And I think it's amazing because you're here to say like you can do it. So I would love to hear more about that.
Sure. And I will kind of give you a glimpse in my practice a little bit more, but I'm not doing all of it. Like I'm not, a perfect 100% clinician and a perfect 100% mom. I think that picture of like doing it all probably needs a little bit more realism and surrender. The surrender has been like surrender and nourishment have been my words of the year. I also started before I had kids, before I was married, and it's easier to like grind when you don't have kids and you can like work. I worked super hard. I took on extra projects at work. And again, like I mentioned before, very spirit led. I ended up reaching out to and networking with Gina, who does the live shows for Dancing with the Stars. She's a PT. She treats for the live shows. She's been doing it for years. And she also contracted out their tour. So you think you can do several tours. And so I met her in person at CSM in New Orleans, probably in like 2018, sometime around then. And meeting her kind of turned into like a little mini interview, and she offered me a few day shows for So You Think You Can Dance. They don't travel well, they don't even tour anymore, but when they did tour, they didn't travel with a PT. They just found a PT in the city that they were in. And so I did a few shows with that on weekends while I was still working at the hospital. It was a hospital-based outpatient clinic. And so that was just like in addition to. And then after a few shows, she interviewed me at a bigger tour that was coming through Cincinnati, and then offered me a stint on a tour where you're like on the bus, you're sleeping on the bus, you wake up in the next city, you treat, you sleep on the bus, you're traveling with the event. And so I presented that to my manager, and I was prepared to let go of the job if they said no and just figure it out. I also, like, my risk profile is pretty high. I land on my feet. I'm ready to like jump in and figure. Again, I didn't have kids, so I could have done anything to make money if I needed to. So, but he let me. And I think I'm probably the last person he let because COVID hit during that tour. The country shut down literally while I was on tour. It was absolute chaos. Not from a tour perspective, they were very organized and it went very smoothly, but just the whole country was chaos. So I flew back home to like all the empty grocery shelves and all that. But so back to what I was saying earlier, I asked, and like what Lauren said, right place at the right time. I really listened to my intuition. I really practiced discernment and like, is this what is right for me? Gina takes really good care of the people that she contracts out. So I knew, like, I felt very safe with her being, in charge of the tour. It was great working environments. So I don't have like a step-by-step way to tell someone to do this besides like get yourself in the environment. I'm really lucky to have friends who are still in the industry. And so I can ask them like, what is the biggest problem that you're seeing right now, and get a really honest, candid response, and not a professional response, if that makes sense. So get your whatever niche you're trying to delve into, live it for a little bit. And that's where you're just network, make contacts, I assume that I can learn anything from anyone. So anytime I meet someone, there's something I can learn from them, and a conversation is free. So just, really, I guess network would be my number one advice.
I love
Oh
that.
my
And I
gosh.
think that's part of one of the things that like we talk about a lot. And especially conference season is coming up. And I think some people look at conferences like, well, it costs me a lot of money. I don't know if the sessions are going to be worth it. It is not just about that. It is about networking. Like truly, like I love going to conferences to make more connections, to
Right.
have conversations. And I love what you said about like a conversation with somebody is free. And like you can really make a good impression on somebody and vice versa, that can create that and open doors for you that you don't even know are there.
Right.
So I think
Just like
that's
one
so good.
one person, like one right conversation, right place at the right time to make something awesome. So,
Mhm.
always have the conversation, always assume you can learn from the person you're talking to.
And I think that's really big for like the growth mindset. And I think that this is the distinction. I've done a lot of like reflecting on what makes a clinician go out and be able to own a practice where you're asking people and Mary Beth, I don't know if this is the case for your practice, but I know it is at least in some form for Lauren and I. We're out of network. Is your practice out of network as well?
Yeah.
Yeah.
And I realized I didn't finish that question. So when my first child was born, I was really growing more of a in-person practice. I was up till 2 or 3 a.m. trying to figure out how to build websites, trying to, do all the things. And I quickly realized it wasn't worth it, especially if you're trying to do a local practice. All you need is good outcomes, and word of mouth is going to travel really fast. And all of the things that you're told that you need to do, like social media, websites, you don't really need to do if your focus is local, because word of mouth is going to be the best thing for you. If you're getting good outcomes, your patients trust you, you're getting them fairly quickly, it's the best thing you can do. And then as my daughter got older, I realized that I really wanted my focus to be at home. My husband travels a lot. I know that their childhood is super fleeting. I'm like, you live it every day. You see how fast they grow up. And I knew that I really wanted my focus to be at home. So I started figuring out how I could do that. And I ended up from then until now, I won't give you the long version, but I'm pretty much 100% virtual at this point. I'll do a few evals in person at studios. I'll travel to studios, so I'm not responsible for rent or an overhead. But most of it's virtual. A lot of them have already tried PT before. Didn't get the results that they want. They got better, but didn't get the results that they wanted, and so they're open to trying a different route. And you know, I have a lot of experience in the dance world and through PT, and I've been in the dance PT world for probably 7 or 8 years now. Don't quote me on that, but I think that's about right. And so they get better pretty quickly and they feel confident with a plan. Like, you can do this now, and then once you can do 20 calf raises, you can do this. And then you get a very strategic stepwise plan to get back, and it leads to a lot of confidence. So I'm pretty much virtual. I'm actually shifting even more to doing more consulting work for teams, and from a like load volume periodization standpoint, I love that because that's how I can help the most dancers. And so you can make it work. You just have to be willing to try. And it helps that, to be like completely transparent, it helps that we could live off of my husband's salary if I didn't work at all. And so I have some cushion. I don't have that like, fear of like, we won't be able to feed our kids the next meal if I don't bring in however much money a week. I do think that you could start it as a side hustle with some PRN work if you are married and somebody has benefits. So just, you have to get creative with it. You have to think out of the box. I think the school system is like, more is better, more certifications, more training, more formal education. And that works for some people. But, if that's not the route that you need to go financially, think out the box and get creative and make whatever your niche is your hobby, so that you're getting in there, you're meeting people, and a side hustle could blow up really quickly. And then you don't lose any of that security. So I was very blessed with cushion in my like postpartum period, but I think it's very realistic to be able to do it without that cushion. It might be less comfortable than it was for me, but it's still very possible.
Dr. Tig and I sat on a panel last night talking to students, and the question was, should students come right out of school and open a new practice? And so I think I don't have the answer. So please keep listening, but I don't have the answer. I have thoughts. As I said earlier, to ask someone to not use their insurance benefits, you have to be results driven. They have to be seeing the results, or else they're not going to continue to pay you. In my view of what I have seen, you can't just be someone who works a 9 to 5 and own a super specialized practice. Like, it's just not how it works. You are staying up until midnight, like you said, maybe like 2 a.m. You eat, you breathe, you sleep. You're always looking, who can I reach out to? My Instagram account has been incredible. That's how Mary Beth and I met. Like, she asked a question and my name came up and we started messaging each other. You're
And we live
constantly
a
looking.
street away from each other.
Yeah, and we live 2 streets over. Like, what are the chances? But hey,
That's what I was going
the
to ask.
thing
Did you
is,
know that before?
No.
no, it was crazy. It was
Yeah.
so random. But that's the thing, is like, you never know who you're going to meet. My neighbor, their family owns 15 PT clinics, and his mom has a PT school named after him in a different state. Like, what are the chances? But because we walked outside and we're like, hey, what's your name? A door opened. And so I love networking. The private practice conference is happening the week of, what is today, the 12th. Like, it's happening right now as we're recording this episode. And I'm like having the most FOMO because that's a great place to meet people. But I
And to
think,
get ideas, even though those sessions are really short, it might spark something that you're like, you know what? I never thought that I could even do that. And so just to get ideas is really priceless.
and that's, I think, what comes back to that student conversation. Like, if you are going to own a niche practice, you're not going to be a niche practitioner year 1 or 2. You're going to
And
be
you're not
on
going to
your
get a playbook. You're not going to get like a step 1, step 2, step
Yeah.
3, step 4. Like there's got to be some creativity involved and just like putting yourself out there and being totally okay with failure, which
Mhm.
comes with practice. But
It does come with practice for sure.
it's
Yeah.
it's not going to work every time.
Yeah. And
And I
then,
think we've all
like
go
you
ahead.
you were saying, Mary Beth, this like the side hustle piece of this. Like, could you start? And this is what was on the panel. The discussion on the panel last night is what I think when somebody says business, we think 40 hours a week, seeing patients all day, every day. There is not a single person on this podcast who is doing that in their business. And I'm going to say we all have very successful businesses because they feed the need that we are trying to accomplish. So, what is the need that you want? Do you just want to work like 2 hours a day, charging cash on a Saturday or a Sunday, still work your 9 to 5 weekday job, but maybe you have 3 patients who want to come see you on the weekend? And so instead of going and working at an inpatient rehab on a PRN shift or a skilled nursing facility, you go work for yourself and you go see 2 patients instead of 8 patients. Now you still have your weekend, but you've still been able to, make your extra money for whatever you're needing it for. Like, I think we have to reframe what business is. It doesn't
And how
mean
you
40
get
hours a
there.
week.
So when my first daughter was young and I realized like in person is not like 100% in person is not going to be what works for me in this chapter right now. I found a business incubator who was promoting like a hybrid practice. It's called the Honey Badger Project. I don't know what they're still teaching, but this was 3 years ago, 2 years ago. And they were teaching a hybrid model. And so I um, was in that business incubator and he did an exercise that like I still use to this day and it's life design and it's basically looking at like writing out what your ideal work life balance, what your life would look like from like an hour by hour standpoint every day of the week. And instead of just like, yeah, I'll do this, I'll do this, I'll do this, like picking the low hanging fruit and just doing as much as you can. Like I said, more is not better, more is not more. Work backwards from that life design to see like, okay, what's the most intentional next step that I can do to have that that long-term goal accomplished. And it may take 5 years, but you're very intentionally getting to that 5-year plan without a higher risk of burnout by just like doing everything. Cause that's what I was doing in the hospital system. I mean, I was hustling. I was doing the side gig. I was doing weekends with, some contracts. I was taking on every project and that is like a really quick, the unintentional do more is a really quick path to burnout.
That's like the mentality too. I think that's why I pursued education. Honestly, like I was 3 years into my profession and I was like, I don't foresee myself doing this. I cannot physically and mentally and emotionally do this for X amount of years. And also I think it adds in a different layer. And I think similarly to the neuro population, and correct me if I'm wrong, Dr. Young, when you're working with kids, you're also working with families. Like I'm not saying working with elite athletes isn't mentally and physically draining. It is. I've worked with college athletes and they're pretty elite, right? But when you add in parents and you add in kids, it's a whole nother layer. And I think of that similarly, like I think of a very complex neuro case. Like there's just a lot going on there. You have caregivers, you have all these different components. And I think for me, it was like, I physically cannot do this like forever. And I 100% agree with what Dr. Young just said about reframing our mindset on what owning your own practice looks like. And I think that is actually why I didn't do it for so long. Like I am definitely the type of person, like if there's an opportunity that presents itself, I'm going to go for it. But I almost feel like the whole like owning your own business, I was like, I don't want overhead. I don't want to have to like work 40 plus hours. And now like similarly, I have 2 kids. Like I cannot do that. And now it comes down to like, how much is my time worth? How much is my time away from my
Exactly.
kids worth? And so being able to reframe what private practice is, I think is really important. And I think for new grads, part of like what makes you successful as a business owner in whatever framework that is your ability to continue to evolve. And that's not to say you can't start your own practice right out of school, but maybe not a brick and mortar practice, something that you can just continue to build and build and build. And I think some of the new grads that we're seeing starting their own practice, that's what they're doing. They are working full time and doing something on the side to really niche down. So then they can say, okay, see you later to this full time gig. I got something that's been brewing for the last 5 years, and now I'm ready to like take it full force. And I think that's the difference. As a student, that is not how owning your own practice was described to me.
Mm-mm.
And it's not what we were seeing either, I
No.
think is the big thing. Like somebody called it the cash-based gig or something like that. It was somebody in an academic setting. They're like, these cash-based gigs, you're seeing them everywhere. Like these were not a thing when we were in school. And so to see it kind of evolve, and we're not on the very front edge of it, but I do think that we are part of the profession that is doing something different. And we see that because our healthcare system, like Mary Beth, your experience. I mean, how many people, when I'm scrolling through Instagram, have these stories of, I was told it's anxiety, I was told to hydrate more, and no one's stopping to look and say, like, hey, we need more. But I fault the system, not the person seeing the patient, right? The doctors are paid with this tiny bit of time, and that's all they have to give you because the reimbursement is different. And that's a whole nother story. But I think it's really easy in the healthcare world to start pointing fingers at, oh, that person's not a good practitioner or this. And that's not helpful, right? Like,
Right.
let's create a space where we can work with the system, where we
And
can,
be the example,
yeah,
be the example and it'll trickle down. There are some businesses that are competitive in nature. And if they see you like treating patients really well and spending a lot of time with them, they see that that works. They may do it from a competitive standpoint too. So it can trickle down to where people are getting a better healthcare experience.
yeah, absolutely. Well, Mary Beth, thank you so much for being on. This was just a
Thank y'all
great
for having me.
conversation.
This was really great.
Yeah, we are just like thrilled to have you. And I think I foresee you being a guest again on the here because I have so many more questions about all the things.
I would love it.
Before we wrap up, do you want to tell our listeners where they can find you in terms of like social media platforms or wherever they can kind of follow along in your journey and, reach out to you if they have questions specific about the dance profession?
Sure. I'm really only on Instagram. And my handle is at embodyu. So MBODYYOU. So yeah, feel free to reach out with any questions. Happy to point you in the right direction or tell you about my experience or anything like that.
Thank you so much. I know our listeners appreciate that. What is your personal rehab remix? Like a unique habit, a hack, or a mindset that you use every day, even outside of like practice? Like what is something that you feel like you utilize every day?
I have touched on it like throughout the podcast, but I would say consistency and nourishment and surrender, especially in this chapter that I'm in right now with young kids. Nourishment from every perspective, physical, mental, spiritual, and surrendering every expectation, every bit of control that I want, surrendering all of it. And I've really practiced consistency in that over the last year or two. And it has brought me so much peace and clarity so that I can like really be present with my kids and also be very intentional with clients and next steps of where I'm heading from the business perspective. So like really taking care of your body and not the like all the extra bells and whistles. Those things are great, but really like the meat and potatoes of eat enough, drink enough, give yourself some rest, some mental rest when you need it. That's consistency. That's my really boring answer that nobody wants to hear.
It's perfect though. I think sometimes you don't need the bells and whistles, like you said. I think it's going back to basics. And I think sometimes we need to be gently reminded of that.
Sure. Well, folks, this is the last episode for the 2025 season of the Rehab Remix. We can't believe we've been doing this for 6 months and that all of you have listened, downloaded, subscribed. We're so, so appreciative for your support in this time. We are planning so many new fun guests coming on next year, new topics, and we have something really big coming out. So be sure you're following Dr. Tig and myself on Instagram. That's where we're announcing it. So look out for that, and we'll see you in the new year.
Thank y'all.
Be sure to sign up for our newsletter linked in the show notes. You can find me, Dr. Young, on Instagram at NeuroElitePT. And Dr. Tag, where can they find you?
On Instagram as well at LTAGDPT. Thanks for tuning in to the Rehab Remix, where you listen in and level up. We'll see you next time.